Now, this breaking news, the 17 Americans who came off of that cruise ship, they're now at a quarantine center in Nebraska. One has tested positive for hantavirus. Another has shown mild symptoms for this disease. So we're going to talk about what's next after this dream vacation turned into a nightmare.
We're going to interview them and assess them for risk. Risk meaning, in this case, risk doesn't mean the risk of dying from the disease or anything. The risk is a high risk if they've been in close contact with somebody who was symptomatic. If they weren't in close contact with someone who was symptomatic, then we're going to deem them low risk. If they were in close contact, we're going to deem them medium or high risk.
Joining me now, Dr. Chris Pernell, public health physician and director of the NAACP Center for Health Equity. Good morning. First, I want to talk about this place they are going. It's not a random hospital in Nebraska. Where are they headed and what's going to happen there?
Good morning, Audie. So they're headed to the only federally funded national quarantine unit at the University of Nebraska Medical Center. So this means this is a normal part of the public health infrastructure that is equipped, that is ready to assess persons who have been exposed to infectious or those, or I should say viruses or bacteria who have the potential to spread and to become an outbreak and or pandemic.
Talk to me about those risk levels, because what makes this a news story is the human-to-human transmission, which is supposed to be unusual, except with this Andes strain. So tell me what they're going to be looking for.
Definitely. First and foremost, I want to reassure the public, hantavirus is not COVID. Hantavirus does not spread easily or does not spread efficiently. What we saw in COVID was a type of a viral infection that was aerosolized or airborne and spread from human to human, regardless if the person who was infected with the COVID was displaying any symptoms. That's not the case with hantavirus. Okay, so first and foremost, let's start there. What the doctors are going to be looking for is these persons who were on a cruise ship that was hit by hantavirus, are they displaying flu-like symptoms? Do they have fatigue? Do they have muscle aches? Do they have fever? Or do they have gastrointestinal symptoms like diarrhea or nausea? In rare cases, hantavirus that does spread from human to human by that Andes strain can go on to develop a hantavirus pulmonary syndrome. So is the person beginning to develop a cough? If that cough progresses and it comes very severe, you can have an infection that turns deadly in about 30 to 40% of the cases.
I want to play for you the Director General of the World Health Organization, who was trying to kind of assuage people's fears, especially in the U.S., around the issues you talked about, people who fear another pandemic. Here he is.
I hope the American people will have faith in their experts also who are already working on this. That should also give them the confidence that this is being managed very well. So that's what I would like to say. And WHO is also here supporting to make the American people safe and the rest of the world also safe.
I hear him saying something that I think is in line with what I saw on social media, people who are afraid of another pandemic and what might come with it. What's your message to those people who feel that way in part because they don't trust public health officials or their trust was shaken during the COVID pandemic?
Yeah, where I start is that the American public, we were scarred by COVID. It was a once in a lifetime, once in a century pandemic. And now on top of that, we have failed leadership at the very top of the federal public health infrastructure. There's a lack of stability. There has been mismanagement of other issues around measles. We have the lowest vaccine confidence that we've seen in recent history, and there hasn't been clear and consistent communication. That's what's stoking the fear. What we in public health who are on the front lines, whether in local or state positions, we need to speak up and we need to speak clearly and just discuss the facts with people. And unfortunately, I'm not very confident, I should say, in the most senior federal public health officials, but I am confident in those professionals like who's manning and working at the National Quarantine Unit, like in our local and our state public health departments.
That's Dr. Chris Pernell. We're talking to her about those the folks who were on that cruise ship that was struck with hantavirus. They're landing now in Nebraska. Dr. Pernell, thanks so much.